Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're exploring the real cost of chronic disease in the United States. We often hear about breakthrough drugs or high-tech procedures, but our healthcare spending continues to rise. And more people are struggling with illness than ever before. Chronic conditions such as heart disease, diabetes, and cancer keep climbing, and families face enormous challenges every step of the way. Joining me is my co-host, Alara Sky. We're going to examine why a focus on symptom management isn't enough, and why addressing the root causes of chronic illness is so important.
It's great to be here, Ethan. Chronic disease now accounts for about 90% of our country's annual healthcare spending, which is around $4.5 trillion. Yet, despite that staggering figure, rates of diabetes, heart disease, cancer, and neurodegenerative conditions are still rising. What we're seeing is a medical system heavily invested in high-cost pharmaceuticals and procedures. Unfortunately, these strategies rarely restore health at the cellular level. Instead, they often trap patients in a cycle of taking more drugs, undergoing more procedures, and watching their bills pile up. True healing is lost in a system that emphasizes symptom management over addressing the deeper sources of illness.
Let's talk about the financial toll this cycle creates for those living with chronic conditions. Many people believe that having health insurance will protect them from devastating medical expenses. Yet, recent studies, including one published in JAMA Internal Medicine, show a harsh reality. In that study, over 2.85 million adults were evaluated, and more than 38% had at least one chronic condition. As these conditions add up, 2, 3, or more, the risk of unpaid medical bills, bankruptcies, and credit issues jumps dramatically. It turns out that 7.6% of people with no chronic conditions had medical debt in collections, whereas that figure soared to 32% for those living with 7 to 13 chronic conditions.
Exactly. And the same study highlighted how having multiple chronic conditions increases delinquent debt, low credit scores, and even bankruptcy rates. In fact, individuals with the most chronic conditions experienced a fourfold increase in bankruptcy compared to healthier individuals. This burden isn't just about medical bills or co-pays. It affects every aspect of people's lives. When someone's health declines to the point they cannot work, their entire family may be forced to carry the weight. You have spouses and even children stepping in as caregivers, often having to reduce their work hours or leave the workforce altogether. It creates a cascade of financial instability that can be very difficult to overcome.
Beyond personal finances, the larger economic burden of chronic disease is massive. The CDC indicates that 90% of our nation's healthcare spending is channeled into these conditions. On top of direct medical costs, there's also the loss of productivity. Workers who can't stay employed due to illness may lose benefits, and their families suffer the ripple effects. Government programs like Medicare and Medicaid are also feeling the strain. In 2010, for Medicare beneficiaries who had no or just one chronic illness, the annual cost to Medicare was around $2,000 per person. But for those with 4 or 5 conditions, it jumped to over $12,000. And for patients with 6 or more conditions, it skyrocketed to over $30,000 each year. Given that chronic illness rates continue rising, these costs are likely to be even higher today.
And while all of this is happening, we see that prescription drugs are big business for pharmaceutical companies. They aren't necessarily designed to cure conditions, but to maintain a patient's dependence on them. One glaring example is Lipitor, a cholesterol-lowering medication that has generated over $150 billion in sales. Yet, heart disease remains the leading cause of death. Another example is insulin. Costs continue to climb, even though type 2 diabetes is often preventable with targeted dietary and lifestyle changes. By heavily relying on these drugs, we don't address the underlying cellular dysfunction that drives chronic illness. Instead, we end up masking symptoms and generating profit for an industry that thrives on repeat customers.
This endless cycle of medication is also evident in pain management. A study in pain medicine revealed that among chronic non-cancer pain patients, opioid prescription rates jumped from nearly 60% to over 74% in just 2 years, and 3/4 of those users stayed on opioids for the long term. Even more concerning, patients reported persistent pain and daily life interference. The drugs didn't improve their overall condition. Many also encountered something called opioid-induced hyperalgesia, where the body becomes more sensitive to pain. The medication that was supposed to provide relief gradually exacerbated the pain. Breaking free from that cycle can be incredibly difficult, and only 1% of patients in the study managed to discontinue opioids over the 2-year period.
We see a similar pattern with antidepressants. Countless people remain on these medications for years, sometimes decades. One account in the Washington Post described someone who was on antidepressants for nearly half her life. She assumed those pills were her only option, but when she tried to get off them, she experienced severe withdrawal. It took months of debilitating symptoms before she realized just how dependent she had become. According to research, approximately 15.5 million Americans have been on antidepressants for more than 5 years, often without serious reevaluation. A systematic review in the Lancet Psychiatry reported that around 15% of individuals who stop antidepressants experience significant withdrawal symptoms, with 3% suffering severely. These experiences highlight that more medication does not always translate to better health.
Chronic illness also leads to tremendous emotional strain. Studies indicate that a high percentage of individuals with ongoing diseases like cardiovascular problems, cancer, and metabolic disorders experience chronic stress, anxiety, and depression. This stress isn't limited to patients alone. Caregivers often feel exhausted and overwhelmed as well. Family members step in to manage appointments, daily tasks, and medications. Over time, that constant responsibility takes a toll on their mental well-being and financial security. Many people also become isolated. Limited mobility and ongoing fatigue can make it hard to socialize, which deepens the depression. Friendships can fade, and marriages may suffer under the new dynamic of patient and caregiver.
That's right. And despite technological innovations, conventional medicine has tended to ignore something critical: cellular function. The late Dr. Ray Peat dedicated his work to bioenergetic medicine, which underscores the fundamental role of mitochondrial health. These tiny powerhouses in our cells rely on the right balance of nutrients, including glucose, for optimal performance. Peat's insights challenge the idea that low-carb diets are always beneficial, arguing instead that carbohydrates help fuel the mitochondria, support thyroid function, and help the body manage stress more effectively. When we fail to address these basic metabolic needs, we risk perpetuating the very conditions we're trying to treat.
Another example is the issue of seed oils, specifically those containing linoleic acid. Dr. Peat warned about them years before mainstream medicine started taking a closer look. Linoleic acid can disrupt mitochondrial function and promote inflammation, which sets the stage for a variety of chronic illnesses. Yet, these oils are still marketed as heart-healthy. The disconnect between evidence-based cellular research and the recommendations we typically see reveals that the current system focuses on profit, not prevention. Many beneficial dietary and lifestyle approaches remain on the margins because they offer little financial incentive for pharmaceutical companies.
Precisely. And that points to a bigger problem. Profit-driven approaches overshadow promising research on nutrition, metabolic therapies, and other interventions that could genuinely improve health at the cellular level. When pharmaceutical sales are a primary revenue source, there's little motivation to promote practices that reduce medication use. It becomes easier to suppress or dismiss the work of researchers like Dr. Peat. This leaves patients stuck in the conventional loop of drug-based treatment and repeated medical visits, while their underlying cellular dysfunction remains unaddressed.
With so many individuals facing ongoing health challenges, it's time for a significant change in our approach. Instead of treating chronic diseases as inevitable conditions that require a lifetime of medications, we need to prioritize therapies that restore cellular health. That means looking at factors like proper nutrition, mitochondrial function, stress management, and exposure to toxins. It also means revisiting our standard medical protocols so that true healing, not just symptom reduction, becomes the goal. We have to move beyond the mindset that people will always be patients, reliant on increasing pharmaceutical interventions.
That's the essence of this wake-up call. Our current healthcare system is geared toward managing long-term illness rather than resolving it. The body, when provided the right conditions, can be remarkably resilient. Addressing core metabolic needs, reducing environmental toxins, and adopting more informed dietary practices can make a profound difference. The solutions exist, and some researchers have been discussing them for decades. But until the system realigns its priorities, millions of people will stay stuck in a costly and incomplete model of care. True health is more than avoiding symptoms. It's about restoring and maintaining vitality at the cellular level.
Well said, Ilara. That brings us to the end of today's episode of Dr. Mercola's Cellular Wisdom. We appreciate everyone who joined us as we explored how chronic disease impacts not only our finances, but also our mental, emotional, and social well-being. Thank you for listening, and we hope this conversation sparks a deeper look at how we can move from merely managing illness to genuinely reclaiming health. We'll be back next time with more insights that challenge the status quo.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.